Good afternoon, everyone, and or good morning to some of you. It is so good to see so many of you here today. My name is Earl, and I am the proud president of People First of Canada. I am so proud of our organization. We exist to represent and advocate for Canadians like you. And people who have been labeled of intellectual and developmental disability or developmental disability, and we're just so glad that you're able to join us. And as an organization, we're very proud to be part of it. Let me just take a moment to offer a couple of things. First of all, I would be remiss if I didn't offer a couple of words just to honor our past member, Richard Rustin, who unfortunately passed away a couple of days ago. So my heart is certainly with everyone and his family and many members across this country. His legacy will live on. And we'll continue to make that. Today is also World Pink Day. So let's all show our support to end bullying. So many of us certainly know what bullying's been like as we've been affected by that. So good to actually see so many familiar faces and some new ones as well. I think that's excellent. Thank you so very much for all coming today. The first webinar series is People First Initiative that was created just for you. Want to emphasize again, just for you is how we created it a few months ago. Some of you will remember we reached out and listened to members from right across the country. You and so many told us that information would be helpful during this pandemic, and also after the pandemic as well, or what normal is, and any public health emergencies. So far, we've hosted webinars on mental health, fitness, and nutrition. And today, it's all about vaccines. It's such a very important issue. The fact and the fiction and the truths, and to find out the truths about that. COVID is continuing to spread. It's something that's on everyone's mind. There's a lot of fake information out there about vaccines, and some of it's dangerous. Today, we want to help make it easier to find and share health information for you and to gather. And with that, I would like to introduce your host today. Her name is Donna Brown. She's the People First New Brunswick president. So I'm honored to pass it over to Donna to be the host today. So thank you.
Thanks so much, Corey, and welcome everyone. If you are joining us today, the topic for today's webinar is Fact or Fiction: Finding the Truth About Vaccines. We have a French translator on the line. Please hit the translation button on the bottom of your screen and then hit French. If you want to listen in English, please hit the French English button. We are recording the session today. If you do not want to be on camera, please turn your camera off. I'm thrilled to have the expertise of our guests on hand to answer our questions today. We'll be hearing them from them soon. But first, I'd like to introduce Bobby Ray, a member of People First who has agreed to share her experience and perspectives on the topic COVID-19 and finding the best information. Thanks for joining us. Also, Bobby Ray lives up north in the Yukon Territory. Bobby Ray?
Hello, everyone.
How are you today?
I'm good. How are you?
Good. I'll ask you some questions, and okay. So like Gary said, we've been dealing COVID for almost a year. How did it affect you when it started?
Like, I go for People First, and I can't see my People First members, so I have to do it on Zoom too.
Yeah. Where did you get most of your information about the COVID?
On the computer.
Do you ever do you ever look for information online?
Yep.
Where do you look?
On Yukon COVID information.
Okay. We hear that the northern communities can face a bigger COVID risk because it's harder to access healthcare and healthcare services. Is that true where you live?
I think so, because we have. Are you okay if I get one of my staff to answer this question with me?
Go right ahead.
Like, what was the question again?
We hear that the northern communities can face a bigger COVID risk because it's harder to access healthcare services. Is that true where you live?
Are you okay if I come back and get one of them?
Yes, you can.
Okay. Hey, Cole. What happened to us then?
Yeah, we're playing. I forgot. Oh, well, gosh. Okay, don't you? Yeah, I'm down here for a few minutes.
What was the question, Donna? Because I got my staff, Kathleen.
Okay, so we hear that northern communities can face a bigger COVID risk because it's harder to access healthcare services. Is that true where you live?
So in Whitehorse, do you find it difficult to find a doctor or a hospital?
No.
No.
No. So it's because you live in the capital city, right?
Yeah.
Well, you have to tell her
Because I live in a capital city.
we have a
Okay.
hospital.
We have a hospital and a doctor's office.
Okay. Have you been thinking about the COVID vaccine?
Yep.
What is your plan for the vaccine?
What's your problem?
To get it.
What's your problem?
Okay.
You don't even have to.
I'm so glad you could share, Bobby Ray. Just with COVID across the country are different, but also the same. We all have our questions and concerns. So before we proceed, does anyone have questions for Bobby Ray? Questions or comments? Yes, Kurt.
Thanks so much for that good explanation. Is there anything that's that you fear about not getting it? Like, is there any part of you that says, "Well, I have a lot of questions," or are you just really eager and excited when it comes? Like, do you have any fears around that?
Yeah. Are you afraid to get the vaccine? Are you?
Yeah. I'm afraid a little bit. I never got my first dose.
Mm-hmm. And what are you afraid of?
I'm afraid of needles.
Perfect. Thank you.
Does anyone have questions or comments for Bobby Ray before we proceed? I see no one. Take the mic off. Then, okay. Next, we have Donnie to bring his perspective from out east in Nova Scotia. Welcome, Donnie.
Welcome.
I'll ask you a few questions for you as well, Donnie.
Okay.
So, Donnie, what about you? Where did you get most of your information about the pandemic?
Most of my information is through television, the computer, and my community support workers and people out and about. Like if you go to Timmy's, you go to, other places like the malls and stuff, people talk about it and how they're getting along with it and what they're doing with it and stuff like that. So I get my information through a lot of places. Like, you go out and people talk about it, and Timmy's, like I said, then on the news and on the computer. So I get a lot of information, it's ongoing almost every day. So I get bits and pieces almost every day about it. So I'm always keeping, advised about it and what's coming up and what's not coming up.
Do you ever look? Do you do you ever look for information online? And how do you know where to look?
I go mostly to the Nova Scotia COVID site, and they give you the update about how many COVID symptoms there are, and how many COVID symptoms, and when you're going to get vaccinated, when you're not, and how old you're going to be. Right now, they're saying people 80 and over can get it right now. There's a place that they can get it, but people younger probably won't get it until the fall. Till the fall. So by the fall, everybody should almost have it.
Okay. What were most worried about when it started?
Not really really a lot with me, because I don't really get worried about big things like that. What happens, and you're gonna come across something that's gonna give you a little downs and that, and scare you a little bit, but you gotta take it by one and listen to people what it's all about and how to take care of yourself and stuff, and not really worry about it. To me, the only really worries that I had is like you couldn't do things like you used to able to do, go places and do stuff. You're always crammed up in one place, and I'm not a person to stay at one place for so long. Like in the house, if I stay more than 48 hours, I get kind of want to go out and socialize with people and get to know what's going on instead of have to just sit around. So that's the only problem that I had. But other than that, I took it one by one. What can you do? You just got to go about what they say, what the health department says, and the doctors say, and you just got to go with the flow.
Thank you, Donnie. Have you been thinking about the COVID vaccine?
I have a little bit. Um, I'm not really allergic to anything, so I don't think it's gonna do me. But I had a friend that my all my CSS clients got theirs, and they got the second one, and one person in the second one got a little sick, but not too bad. She got a little bit of diarrhea, stuff like that. She felt like she was gonna get sick to her stomach, but she never. And she got swelling in her arm, but today, it went down a little bit, and she's feeling a lot better. So
Yeah.
she's getting over it. It was just minor effects, but
Okay.
I'm just worried about if I will get effects from it, but I don't think I will, because I'm not allergic to nothing. So I think it'd be pretty well fine for me.
So, thank you. What is your plan for the vaccine?
Mostly just the plan for the vaccine is get the vaccine and make sure that it works right, and make sure that prevents you from getting it, and when everybody else gets it, there might be a little bit of difference in COVID that might open a few more things and stuff like that. Eventually, down the line, it's going to get better, because they can't really keep this going on for too long. Because if they do like that, then it's going to be, people are just going to go, berserk or something, and something might happen. Might be another shooting, I think, or somebody might do something to themselves, and you don't want that. So that's the worry thing that I'm worried about in the long term, because if it keeps going on and people keep doing this and this, they're just going to get fed up with it. And if the government opens stuff real quicker than expected, it might get a lot better than worse.
Thank you, Donnie. Before we proceed, does anyone have questions or comments for Don?
I do. My name is Kevin Johnson. I'm the president for People First of Manitoba. I just found out that I haven't been vaccinated yet, and I have uh, two surgeries coming up that I have to get done. Any advice for me how I should handle this?
What I think that I would do is like you had surgery and you had that. Well, make sure your doctor's got all your information and make sure that he gets to go ahead for you to have the vaccine and what he thinks the outcome would be for you. And then you wouldn't be so nervous to get it because you have all the information from the doctor and you know what the outcome might be, and it might ease your conscience more to know what the outcome is, and he needs you to go ahead and say go ahead and get it. So you'd be a lot better off knowing that your doctor says go for it.
I'm not so worried about the needle. I'm more worried about um with the COVID going on and not knowing how safe the hospitals are to have these surgeries done.
Well,
So,
what they will be doing is getting like you talk to your doctor and the people around you and know what's going on and get all the information you can. Then I think you should be fine.
well,
Okay,
thanks, Donnie. Oh, thanks, Donnie. That was important to hear. We appreciate it.
You're welcome.
We're going to bring Corey Earl back now. Corey was recently vaccinated for COVID-19, and we're all very curious to hear the experience was like. I was so recently vaccinated, and I wasn't sure at first, but then I decided to do it because at first I hear that the vaccine could be side effects, but it's I told myself that that it's better to take the vaccine to protect from the COVID. It's pretty much the same thing as we take for an influenza. So if we take the same vaccine for influenza, we can take the vaccine for COVID. Well, that's my opinion. So let's hear from Corey. I want to hear about his experience.
Thanks so much, Donna. Yeah, so I just got vaccinated on January 17th of this year. So at work, I work in a long-term care facility, so we were classified as early on stages, but nevertheless, so there's all kinds of information at work about the vaccines. I was nervous because I, like Bobby, don't like needles. So my anxiety went really, really up. So when they turned around and it was only optional at work, when they turned around and said, "Hey, we're gonna give the vaccines out to people living here and to some staff," I had a choice where I could wait till, well, I guess this last Friday, or the interim executive director time turned around and offered if I wanted to get it done quicker, and I went, yeah. So my anxiety. So what I did is I got to educate. I'm very thankful and very fortunate that our work held team meetings every week to give information on the vaccine because there was anxiety, and also because I'm really badly allergic to bees, I had to actually consult my doctor first, just to see whether I could get it done there or done at a hospital. And so anyway, he approved it. And I went in that day to get the vaccine, and a bunch of people, a bunch of staff in there, and I'm like, and I just started cracking up jokes because I'm like, oh my God, I got to get through this whole vaccine thing. And everyone's like, oh, you don't like vaccines? I don't even like needles, period. Um, anyway, so when the woman turned around and was getting ready to give me a vaccine, she's like, don't look at me. And I was like, oh my God, I gotta look at that needle. Anyways, so I joked with her so when they took, so I said, I better get a picture so at least proof I got it. And then I started making jokes and she went, she said, have you had a needle recently? I went, ha, no. You think I wake up every day and say, pick a needle in me? No, not a chance. So anyway, so she did give me the vaccine. So I turned around and I was like, could you please finish? Like, could you please like stick the needle in me? And she laughed and she said, I'm already done. So I actually didn't feel anything. Um, One of the things that I learned for myself though, is making sure I eat prior to going because I actually got very nauseous from not eating. And so I actually went home and no pain, absolute no pain at all. And in fact, I got it done in my right arm, which probably not the best thing because that's the arm that I normally write for. And got it done, no problem. The people there were phenomenal. They talked to me during the entire process to make sure I felt comfortable. My thing was just laughing and just trying to make sure I cracked jokes up, just to try to exciting. So they turned around and so I got it done. The next day I woke up and I attended meetings by Zoom and I actually didn't have any pain. Like everybody's like, oh my God, how are you doing? And I was like, I actually feel good. Like it's almost like I probably just need the vaccine because it gives me more energy. So anyways, now having said that, I just had the second vaccine last Friday. So I have had my 2 vaccine shots now. And I will say that the second shot, I did have side effects at the time. And what the side effects were, is I was exhausted. And that's part of it, that you will feel that. I actually had headaches and my arm was really badly pained. And so I did get slightly a small bruise. Now, having said that, within a couple of days, I had the next day off work. And by Sunday, I actually started feeling really, 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 really good. So just taking some Advil for the headache really helped, but also putting some ice on my arm as well. But exhaustion, all that does happen. But I am staying at work for till 10 p.m. and so second vaccine had a little bit of side effects, but nevertheless, I mean, I'm fully vaccinated now, and I feel a lot more better. Heading into work because I was nervous about the whole myths around vaccines, because one of the biggest things that we often do is we look on social media, and that is not the best option to look if you want the truth about vaccines, because people have different mixed feelings. So that's where I had to turn my head off of social media and focus on actually getting real information. And I can honestly say that I feel a lot more better than I have, and so grateful that I took the opportunity to get the vaccine early on, and get the second dosage within 32 days of it being distributed. So the whole health unit was phenomenal working with me on that. So.
Sorry. Does anyone want to ask Corey a question? We can hear from 1 to 2 people.
I can say it.
Okay.
Hey, Corey.
Yeah.
I have a question for you. How long is the virus is going to be gone if I asked?
Sorry, how long?
How long is the virus is going to be gone? Or will be about to normal again?
So that's $1 million question that I think a lot of us are asking. I think and the good question, by the way, Joanne. So good to see you too. It's one of the things that a lot of people have been asking. Just because we've been vaccinated, and I know there's doctors that will speak to that aspect, doesn't mean that we're also going to lift the safeguards, right? Lift the regulations and etc. It just means that we'll head into a new normal, and what that new normal will look like will depend on how people follow social distancing and etc. But that is $1 million question. I think a lot of us want to get out. And this also varies by province to territory. This is not necessary on one side of the country, right? I mean, so this will vary across the provinces and territories. But as long as people continue to keep up the social distancing, continue to wash your hands, and et cetera, we will be able to get through this quicker. A bunch of us were talking the other day. It is our hope that Canada does a lot more better on this and that people can begin to have their family over on Christmas. That is the goal that we're hearing a lot of our towns, stuff like that. I'm also reminded that a lot of families at our home, a lot of people that live at our home don't have families that come in right now because of this. So I'm also reminded that we need to do a part. But good question. It's $1 million question. And I'm sure the doctors will be able to answer it, say, no, I'm just joking. Thank you.
Thanks for sharing all of that, Corey. It's so important to hear real experiences. One of the most difficult things when it comes to pandemic is making sure that people are getting the right health information. Sometimes it's hard to know what is true or what is not true. We have to be careful, especially when it comes to dangerous viruses and information about vaccines. To help us with this, I would like to welcome Irfan from the for Addiction and Mental Health. We asked Irfan to share with us today because he's an expert we trust and have worked with before. I'm going to hand it over to you, Irfan.
Thank you so much, Donna, and what a pleasure to be here today and talking to all of you. I can hear and see from this conversation that you're all super excited to hear and are very, like, you're thinking about vaccines and what are the right places to get information. And I just want to say you're on the right track, and I want to encourage you to keep doing this great stuff that you're doing. Like a lot of people have already mentioned, getting the right information is so important, especially nowadays when there's so much information out there. It can be hard to tell what's right, what's wrong, who do I trust, and where do I get the information that will be most helpful for me. So I can share a little bit of information, a little bit of tips around getting better information, especially as it relates to vaccines or as it's about vaccines. So like Donna mentioned, I work at the Center for Addiction and Mental Health. I work at a lab that focuses on research for people with intellectual and developmental disabilities. So that's where my expertise sort of comes from. And part of the work that we do at our center is putting together information about health and mental health for this population, for people with intellectual and developmental disabilities. So when COVID came along, we recognized from a lot of people saying that, the information that's out there is very difficult to understand. We need to know what's going on so that we can care for ourselves and make sure we're doing the right things, so that we make sure that we have the right health. And a lot of people in our lab got together and put together loads of resources on COVID. And we actually developed a website. It's called hcardcovid.com/info, and I'm happy to share that in the chat box as well. And that's the site that we have where we're putting together and having information about COVID, about the vaccine, and a lot of resources that are helpful for people with intellectual and developmental disabilities. So I've put that in the chat box for you guys. But what I want to do as well is I want to show you some of the resources that we've developed that can help to understand a little bit more about what's going on right now. But before I share those resources, I want to talk a little bit about information and the right places to go for information. So given that there's so many places we could be getting for information from, we could be going to Facebook, other places on social media, websites, YouTube. There's so much out there, and there's so many people talking about different things. People are forwarding messages to each other, but how do we know what information is good information that we should trust and we should follow? So the number one source that I will encourage all of you to reach out to would be your own healthcare teams. So that's your doctors, your nurse practitioners, if that's someone you have, people that are involved in your healthcare. The reason I say that is they know your healthcare situation best. They know you, and they can give you advice based on what they know about you. If there's certain medical conditions that you have that can impact you or make a difference to your decisions, they will be able to have a discussion with you about what are the best steps for you. So I really encourage you all to take times to book an appointment and have a conversation and talk to your doctors. You can always ask people that you trust to help you set that up, whether that's your family members or your support workers, to set up a time and to have a conversation with your doctors. So that would be the biggest resource that I will encourage all of us to follow. Other resources that are good would be government websites. So the Government of Canada website or different province websites. I know Donnie was talking a little bit earlier today, mentioned how he accesses information on the Nova Scotia website because he's living in Nova Scotia. So just like that, each province has their own government websites. So that would be a good place for information. But sometimes information on those websites can still be a little bit hard to understand and still in very difficult language. So one of the things that we've been working on, and my team, is putting together information in a method that is, or in a way that is easy for more people to be able to understand. We've tried to make information more accessible. And I'm actually going to share my screen now to show you our website and to show you some of the resources that we've developed on COVID as well as on vaccines. So this is our website. It's called hcardcovid.com. And we have a lot of information, easy read informations about the vaccine, as well as about COVID and some other resources. So the things I'm going to focus on right now are these two easy read booklets that we developed, which talk about COVID vaccines and what will happen when you go to get the COVID vaccine. So I'll take a few minutes just to walk you through some of these resources. So the first booklet we have is this one called Things to Know About the COVID Vaccine. And the way we developed these is we asked a bunch of self-advocates what their questions were about the COVID vaccine, and we put together these resources. So these resources have easy language and pictures to help people understand. There's a bit of information on what COVID is. Most people know this already, given that we've been living in this pandemic for almost close to a year in March. So there's a few reminders on the symptoms of COVID. And then we have more information on the actual vaccine. So I want to pause for a second and say that vaccines are not only being used for COVID. Like we know, vaccines are used for lots of different things. Some people have mentioned the flu vaccine a little bit earlier today. But also as we're growing up, when we're much younger, when we're in middle school and high school, there's a bunch of vaccines. And before that, there's a bunch of vaccines that we're given that everybody gets. And what a vaccine is a vaccine is a medication that helps your body to fight a disease before you're exposed to it. So it's something that teaches your body how to fight an infection before you get that infection. That's why vaccines are called a preventative. So they stop something from happening before it happens. It makes your immune system stronger to be able to fight some of these infectious diseases. If we didn't have vaccines, there would be a lot more infectious diseases and a lot more people suffering. So the fact that we have vaccines, I'm very grateful that we have this technology. And it's something that is really, really helpful in making sure a lot of people don't get sick with infectious diseases. And I'm so happy to share some of the resources that we have to help us understand a little bit more about the vaccine. So with the COVID vaccine, this is a vaccine that teaches your body how to develop what we call antibodies that can fight the vaccine. So this tells your body, this is what COVID may look like, and this is how you're going to fight it. So when you are exposed to the actual virus, Your body says, oh, I know what that is. That's COVID, and here's how I'm going to fight it. So it's almost like instructions or a recipe of how do you fight COVID. That's what's in the vaccine. Okay. We have a few questions on what sort of research was done to test the vaccine and make sure it works. So we have a bit of explanation on there. But to summarize, people, when the scientists were doing trials on the vaccine, they basically had two groups of people. Some people had a vaccine in their needle that they got into their arm, and some people had a vaccine or an injection which didn't have any vaccine in it. And what they found was they looked at those people after a while of getting the vaccine and that the people who didn't get the vaccine. And for the people who got the vaccine, almost all of those people didn't get sick with COVID. So the vaccine really helps to make sure that you don't get sick with COVID. And if you do get sick, it's only mild. It's not too bad. It's not, you don't get so sick that you have to end up in the hospital. So that's why we're encouraging people to get the vaccine. Important to know that the vaccine is not only for people who have gotten COVID before, the vaccine is for people, for anybody who could get the vaccine. And right now, because who could get the virus, my apologies. And right now, I think almost everybody, given that the virus is almost everywhere in the world, most people will be exposed to the virus. So it's important that as many people as possible can get the vaccine. There are a few people who should not be getting the vaccine, but the best thing to figure that out would be to have a conversation with your doctor about that. A lot of people have questions about allergies. So most people will not be allergic to the vaccine, and the vaccine is fairly safe. What they're doing when they're giving people the vaccine is they're actually making people wait after they've gotten the vaccine in the waiting room of the clinic where you're getting it, just to be sure that you're not going to get a reaction. And if you do get a reaction, the doctors and nurses are prepared with something called an EpiPen that can help to treat those allergies. And yeah, lots of people asking questions about when are we going to get the vaccine, and that's a really, really important question. That more details are coming out as the days are passing, and it's a little bit different in different provinces and different areas. We have some general information on here. Like we've said, people over the UK are the ones getting it right now, and people who live up north are also getting it right now. And they're slowly rolling it out to other people. And then this is sort of a few tips on how to decide whether you should be getting the vaccine or not. So again, encourage you to really have a good conversation with your doctor about your own health conditions and whether the vaccine is the right step and good for you. It's good for most people. But we really want you to have a conversation with your doctor to be able to answer those specific questions about your health conditions. So that's the first info sheet. There's a second one that talks a little bit more about the details of what happens when you go to get the vaccine. But in the interest of time, I'm not going to go through the second one right now. I think I want to have a chance for Dr. Greer to share with us a little bit, and most importantly, be able to answer your questions on the vaccine. So thank you for listening to me. And before I sort of close off, I'll also share that our team have also developed a YouTube video where we have self-advocates asking questions about the COVID vaccine, some regularly or frequently asked questions. And we have a few doctors who have answered those questions. So I'll be sure to share this in the chat box as well. So that's a good resource that you can use to get some more information on vaccines. But yeah, thank you for listening.
I'm so thankful you could come today. We needed to know all of that, and we do now. You can check the chat box here for some of those links, and you can all see the information for the information as well. Thank you, Irfan. In the next segment, we are going to hear from a medical professional named Dr. Elizabeth Greer. She is going to share some information and then take our questions. Some of our questions were submitted before, so she has a list and will answer for those of us. Please remember to stay muted so we all can hear her speak. If you have a question, please raise your hand and either Monica or Laura will let the doctor know. Or you can type your questions into the chat box on the side. Welcome, Dr. Greer.
Hi, everyone. Thank you so much for inviting me. It's really nice to get to come and meet you all. And thank you for your questions and comments. It was really nice to hear all across the country what you have been experiencing. I'd also like to on behalf of other doctors, thank you for all of your hard work and effort to help to contain the COVID virus and keep our community safe. It's not been easy at all, and it's been really hard, especially being socially apart from people who we want to see. And we feel the same way, that we really need to steadily start to get back to normal, particularly getting to see people and spend time with people in ways that we haven't been able to. That's one of the most important things. And I'd also like to thank you for coming to learn about the vaccine, because that's one of the big ways that we'll be able to get back to normal again. Thanks, Irfan, for going through all of that information. I think those are very good resources, and they would be nice ways of going over and reviewing how the vaccine works. I do have this great list of questions, but perhaps, Donna, it would be best if I open things up if people would like to ask questions out loud. And if we don't have many questions, I've got lots that I could answer here.
Sure do. Does anyone have questions for Dr. Greer?
Yes.
Yeah, Dr. Greer. It's a little harder for me to get information because I've got to go to outpatients because my doctor's retired, and he's been retired for 3 years now, and it's really hard for me to really get it. I have to go and wait for, it might be an hour, it might be 2 hours, 3 hours for a doctor to see me because I haven't got one.
That is very hard. That is very hard. In Ontario, and this might be something that you would do with a friend or family member or support worker, we do have doctors who are providing medical appointments over the phone or video for people who don't have a family doctor right now, because this is a difficult time to not have a family doctor. I'm not sure if there's something like that in the Maritimes, but
yeah, well, there is one. There's one that's ready to retire. He's down in Bridgetown. That's about 15, 20 minutes away from me, and he does a little bit for me. He schedules my pills if they're out of if I need a refill, and there's no refills on them, and he gives me a blood test thing, a thing to get a blood test. So he does a few things for me, but most of the stuff is I have to go down to outpatient.
thanks, Dawn. Yeah, that is difficult. Corey, I saw that you had a question there.
Absolutely. Thank you so much, Dr. Girl. And so great to meet you today, as like we're all doing, meeting people virtually, and hope someday we'll be able to shake hands in a probably different way aspect, but meet you. I do have a couple of questions, and one being is developmental and intellectual disabilities. Who do you certainly feel that people with intellectual and/or developmental disabilities should have been prioritized on the first vaccine of being as category, if you will, number one, because that's what they're going by in different categories. And the second question is, if someone were to get the vaccine, because there's a lot of restrictions in terms of a person bringing a support person or et cetera with them in order into whether it's a medical appointment or medical building or a hospital to get the vaccine, will that be allowed to get the vaccine? Will that person be allowed to bring their support or friend or family should they need help? Because yeah, so I look forward to those questions being answered, but certainly what I hear every single day from people is the challenges that not people need that support to be able to help them, guide them through. And while I respect the professionalism at the hospitals and et cetera, they're not the same as someone who trusts that person to be with them.
No, Corey, we really agree. Maybe I'll start with that second question. I've written many letters over this last year for parents or friends or family members of patients of mine with IDD to have a support person with them in the emergency department. If they're getting a CT scan, if they're coming into hospital, if they're seeing a specialist. And it's been fairly successful here. And I think sometimes having that letter from a physician can be very helpful. It's something you can just show or you can just read from. And sometimes having two copies so that, you know, if people get separated, they can get put back together again. But I think coming to get the vaccine would be another time when it would be important to have a support person to explain the forms that are being signed, all those pieces. So that I really agree. And then the first question, we have been communicating with governments throughout the provinces requesting that they at least understand some of the special risk factors for some patients with intellectual developmental disabilities. There's various ones, different kinds of medical conditions, or we call those comorbidities, that people with IDD might have that would put them at greater risk, or people with IDD who live in congregate care, which means in group care. We've also asked them to consider that our patients with IDD who have been in group homes have had to live under some of the more difficult restrictions, like isolation is very difficult in a group home, a little bit different than maybe living in just a family house who can still walk around easily. So we have been advocating and we've had little bits of success here and there, but we're going to keep trying. I'm really glad you raised that.
Thank you so much, Dr. Guerrero. And if we can be of any support any kind of way that we can, we certainly will offer that, just because it's so vital important that people with intellectual or developmental disabilities be put on a list and not have to wait for months away when their lives hang in the balance as well during this. And we want to try to promote the vaccine as well. I also encourage the continued role of supports, because I hear it I live in Ontario, but across this country, I hear different aspects of different parts of the provinces and territories. So it's not the same versus going into Toronto or versus going into Winnipeg or something like that. So, so certainly keeping the dialogue open, and I look forward to having many more conversations about this. Thank you.
Dr. Greer, I'm just going to help moderate here. We saw a hand from Amanda, and then we also saw Elin. So if you want to take them, we'll let you know who else. Thanks, guys. Amanda, you want to unmute? Amanda?
There we go.
Sorry, Kevin. Amanda, go ahead.
I have two questions. Can we still get sick from COVID? Can we still have symptoms of COVID, and can we transmit it to our families if we do decide to get the vaccine? And my second question is it safe?
So it appears that if someone who is vaccinated is exposed to the COVID virus, as Irfan went over, it's very, very unlikely that they would get sick. And if they do, it's likely to be very mild. And it does appear that even if they can't tell that they've been exposed, they are less likely to transmit the virus. We use that word asymptomatically, so pass it along without without being able to tell that that's happening. So that is less likely as well, which is great because that has been one of the problems with COVID. It's a very sneaky virus, right? It can pass along without us knowing. So we're really happy about that. And yes, the COVID vaccine is very safe. There is an extremely rare risk of allergic reaction, and that's generally only if someone has already had an allergic reaction that was serious to a vaccine before, or one of the components of the vaccine. And that information is available on public health websites, and it's also available through your doctor if you have any questions. I've answered lots of them.
I was worried about the new variants, like British, like other variants. Will it protect us from the new variants of COVID that are like from England and this?
Great question.
That's what I'm scared of. I'm scared of if I get the shot that I'm gonna.
Yeah, great question. And so depending on the vaccine, there seems to be some reduced efficacy, which means just how well it works for this new variant. However, we don't know whether that means that it still at least works to prevent hospitalization or prevent a severe illness. That information is still being found. We do still have mainly the primary variant here, mainly the primary COVID virus here. And we definitely suggest getting this vaccine. It will provide protection.
Okay, because with all the new variants, I was scared. I'm like, and I don't like needles, but I'm definitely gonna get vaccinated when it's my turn.
Thanks, Amanda. Elin, did you have a question?
I have a question. So where can we go to get a vaccine in public health? Do you know places where we can go?
And so the vaccine is still being rolled out, mainly just been given to elderly patients who live in long-term care. When the vaccines are coming in large quantities, especially in April and the months following that, we know we are starting to get big quantities of the vaccine. And so we anticipate that people will be notified either through an announcement in your community that says, here is where these people of this age or with these medical issues can go to register online to get their vaccine on these certain dates. Or it may be a phone call from your family doctor's office or another, like the public health agency. It's hard right now because we don't know when and we don't even know how people are going to be contacted, but that information is coming really, really soon.
Okay, but I called my family doctor and they said to me that I have to go to the public health. They don't give us the public health.
That is right. It probably will not be given at the family doctor's office, at least in the beginning stages, later on, maybe. But it was good that you called, and it's good that if someone can help you to look at the public health website where you live, that may be a source of information. But we will be reaching out. Yeah. Elin, go ahead. Sorry, I missed you, I think.
I have a question. I'm going to...
I think Elin's next in the line. Elin Anderson.
Yes. Is,
Yeah, go
is
for it.
Elin there?
Yes.
Okay, Kevin, we'll get to you right after Elin, and then we're gonna go, so Elin and Kevin, and then Bobby Ray.
Hi, I was wondering, when do I get my vaccine?
Same.
I have fatty liver and health problems. When do you get your vaccine for that?
Same thing. We don't know for sure, but it will likely, Elin, be in the next months. So in the next few months, it will be sometime in that time.
Okay.
Thank you for being patient. It is really, really hard how much we've asked everyone to be patient. And Kevin, can you unmute your mic, Kevin? And
Yeah.
yeah.
Okay. I had a couple of questions that I had brought to Monica's attention. I forget what they are, but I am gonna ask. I have a couple of procedures coming up. I have not been vaccinated, so what are my risks if I go for the surgeries?
You know, Kevin, I would say confidently that in any area where there is a major risk to getting treatment in the hospital, that the hospital would take that step of saying it's not safe right now. We can't do this right now. It's not safe. So I would put yourself in the hands of your surgeon and your doctor to know that it is safe to have procedures done, and ask them. We have done it has gone very well keeping our hospitals and our emergency departments and our clinics safe. So we do feel very confident that people should still go ahead with the surgeries and other things they need. If you need to go to the emergency department, please go. Don't wait. It is safe to go there.
Okay, because I'm still waiting to hear from a doctor, and I got a bit of a one kind of surrounds the other procedure that I need. I haven't heard back from the doctors yet whether they're going to cancel one, do the other first, or what they're going to do. So I'm kind of stressed.
You're in limbo and stressed about that. Yeah.
Kind of worried that I don't know what's going on, and I feel they're being a little
Kevin,
bit.
I've had lots of calls from patients of mine who are in limbo because their surgeries were postponed in the beginning of the pandemic, and then the hospitals are backed up, and it's a really hard time. It's hard to reach specialists right now. So please reach out to your family doctor. I've had lots of calls like that, and talked to the person and made sure that it was okay to keep waiting, and talk to them. Bobby Ray, can I?
Do you know after our second vaccine, do we have to still wear our mask?
So right now, yes. Right now, yes. But the whole reason that we're trying to do these vaccines and get everyone vaccinated is that one day we'll be able to lift some of those restrictions. I'm sorry, but yes, right now, it will be.
Because we only have 2 cases so far. That's for us.
Oh, wow, that's wonderful. That's wonderful that you only have 2 cases. That's really good. Oh, it must be hard going along with all these restrictions, you know, for this long period of time. Thank you. We're going to get there. We're going to.
Do you know how long we have to wear a mask now, Dr. Greer? Do you know how long?
We don't know how long. We haven't seen a country with our number of cases get through all of the vaccines that need to happen, get to a point yet where they are able to make that decision. But we have seen countries where there wasn't a lot of COVID, and they were able to go back to not wearing masks all the time. We have seen that. And so we know that one day the future is bright again. Yeah.
Can you send that information to me? Or can Anton do it?
I can connect with you, Bobby. I can help send some information if needed. We can connect with the doctor or Fan after. We can make sure people get that. Okay.
I've just looked at the list of questions, and guys, I think we covered almost everything. There was a question about whether vaccines fight disease better than our bodies, and that the answer to that would be that it's as good, but it's so much safer than getting the virus. It is so much safer to get the vaccine than to get the virus. And the vaccine does do as good a job as our bodies do, from the research we can tell. There were some questions about side effects, and that the vaccine can cause some muscle aches and feeling a bit unwell. Not serious, but it can cause some muscle aches. And that tends to last for a day or two after the vaccine. Someone asked, are those side effects more after the second dose? And some people do find that they are a little bit more. It's hard because even though that's not nice, in a way we like to see that, because it shows us that the body has made lots of antibodies, or is really in a good position to fight the vaccine if it reacts that way. And then just wondering how long before the vaccine would be effective. It appears to be quite quick. You know, we still recommend all the same precautions, but they're seeing that, you know, even 2-3 weeks, pretty quick. How long will the vaccine be effective for? It's such a new thing. We don't know that completely, but we need it to be effective long enough at least to be able to get our numbers down. And then when our numbers get down, then we'll be able to lift restrictions, do those other things. So that's our big push for how long it needs to work for. But we're hopeful that it works a long time, but we're still learning that because everything is so new. Let's say I get a reaction to the vaccine. How would they treat this reaction at the hospital? So the only serious reaction that needs treatment from the vaccine is that very, I can't say enough, very rare allergic reaction. And that requires emergency treatment, and that's given. It can be started right where the vaccine is given, and then the person goes to hospital. But I want to emphasize that is extremely rare, extremely rare.
So Dr. Greer, we just we're gonna be having to end soon. And we had some people with their hands up for a while. There's a Kamakshi and then Corey, and then that will be our last question. I'm so sorry. Go ahead, Kamakshi. I'm sorry, I don't know your first name, but Kamakshi?
Yeah. I just had a question. So after you get the vaccine, right? If you get a reaction, if it stays more than 2 days, then what can you do?
If you're having a reaction symptom that you're worried about, either because of what it's like or how strong it is or how long it's lasting, then you should call your doctor. And if you don't have a doctor, you should call public health. And if you're feeling really unwell, you should go to the emergency department. Yeah.
Okay, Corey?
Perfect.
Then we'll-
Dr. Greer, first of all, thank you so very much for your really important information today. I certainly have learned so much from that, and I applaud you for that, and for all the medical people, because you guys are truly the heroes that have been on the front line. So really, thank you so much for everything you guys have and continue to do. I have a question about the new variants. And how widespread that is. So in our area, we actually have the 3 variants now. And we got informed yesterday, of course, on how things will change now. While our area is in a green zone, our home has chosen to take a gray zone approach to protect the people in the homes from getting the virus. So with the new variants, because there's 3 types now, is that more contagious versus the COVID aspect? Like, what information is there? Because clearly it's become more scary and scary. And when we were informed yesterday that there's actually 3 of them, the 3 ones that are actually hit our area, it certainly made all of us get very anxious and very concerned about the new variants that are spreading.
And so there are some cases, they're still low in number, but we are taking this very seriously because the new variants, some spread more easily, some cause potentially a slightly more severe illness. And then the other good question about how well our vaccines will work. But remember, we know so much more that if we look back at this time last year, when we were very first starting to have cases in Canada, we know so much more. We can act so much faster. We are being so careful. Even what your home has done in taking that step, which is not an easy one. We are confident that we can get these new variants under control and monitor them very closely. But it is difficult. It feels like a step back to some people, but we do feel that there's a great deal of hope as the vaccines are rolling out, and just we feel really confident in how well Canadians have done with this, how much they've listened and helped us, so we still think we are going to get through even these new variants.
Dawn, are you there?
Yes.
I'll
Yep.
send it to you now.
That was so helpful. I really learned a lot today. And that brings us to the end of today's webinar. Thank you all for joining us. Thank you, Bobby Ray and Donnie, for your local perspectives. Thank you, Corey for sharing your experience with getting a vaccine. Thank you to Irfan for sharing your online resources with us. And thank you to Dr. Elizabeth Greer for all your experts' answers and information. I hope you all heard some good ideas that will help you put you first and stay healthy. Just remember that if you have any questions about COVID or one of the COVID vaccines, please talk to your doctor first. Find out what is best for you. Thank you, everyone. Have a great day.
Thank you.
Bye, everyone. Thank you.
Bye. Thank you, people first. It was very
Thank you.
informative.
Bye,
webinar.
Amanda.
Bye.
Thank you, Dr. Greer and Irfan.
Thank you guys both.
Guys.
Thank you, Bobby, Donnie, Cora.